Daratumumab is a CD38 monoclonal antibody recently introduced in the treatment of myeloma patients. The MMI-22 trial that it will be presented tomorrow morning covers really an unmet medical need for myeloma patients because daratumumab as a monoclonal antibody and a single agent has been evaluated in a series of 100 patients with multiple myeloma, but a specific subgroup of patients with myeloma. Patients who have received at least 3 prior lines of therapy and they are refractory to the last one, or patients who are double refractory to the last line containing a proteasome inhibitor and an immunomodulatory drug. This means that the patient population is a heavily pretreated patient population in which there is not any other alternative. Daratumumab has been evaluated as single agent, and this is also important because approximately 30% of the patients achieved at least a partial response. This response, in fact, has been durable, and the median duration of response has been approximately 7.8 months. This translated into a median progression-free survival of approximately 4 months and a median overall survival not reached at the present time with a median follow-up of approximately 9 months. These efficacy results are important and remarkable, I repeat, for a heavily pretreated patients with multiple myeloma. Most then have received conventional agents such as bortezomib, lenalidomide, but also second-generation proteasome inhibitor and IMiDs such as carfilzomib and pomalidomide. But together with the efficacy, the safety profile is clearly remarkable because just some infusion reactions have been observed at the beginning during the first infusions, but they are significantly decreased over the time. And I think that if we consider and if we put all together efficacy and safety, I think that daratumumab single agent will be in the very near future a new option of therapy now for heavily pretreated myeloma patients, but daratumumab is currently ongoing in many clinical trials in early stage of the disease, even in newly diagnosed myeloma patients, and I consider daratumumab will be in the future a backbone for all regimes in the treatment of myeloma patients.